Hello, good crowd. I am so excited today I've got Maggie Ehrenfried on the show. She is the managing director of development for LifeNet International. She's been raising money on CaringCrowd, having great success. Stick around. You don't want to miss this episode.
Welcome to the Your Mark on the World show with your champion of social good, Devin D. Thorpe.
Our sponsor, Johnson & Johnson, matches most individual donations up to $250 at CaringCrowd.org. Maggie, welcome to the show.
Hey, Devin. Thanks for having me. I appreciate it.
Well, we're thrilled to have you and grateful that you would make the time for us. Tell us a little bit about what LifeNet is doing in Africa to change the world and make lives better down there.
Yeah, absolutely. I'd be glad to. I'll start a little bit with why we do what we do. Basically, LifeNet believes that every individual should have the opportunity to live a healthy and whole life. And we're all really committed to making sure that's a reality for the poor and the vulnerable. Everyone on our LifeNet team is motivated by our faith, and we act out of compassion with our medical and our business acumen. The thing is, there's thousands of faith-based health facilities all throughout Sub-Saharan Africa, and they were all started with the mission to heal the sick and care for their communities. But unfortunately, there's a lack of knowledge and resources that often prevents the fulfillment of this mission. So our founder, who's a U.S. businessman, saw that simple solutions implemented at these health facilities could really radically change the care that was provided at the facilities. And on the management side, it could even improve the sustainability of the health facility so that the facility and the health workers there can care well for their communities for the long term. So that's really how we were founded, why we were founded. And our goal is to transform these faith-based facilities to provide high-quality healthcare in financially sustainable ways so that they can care well for their communities for the long term. And the LifeNet model is a pretty comprehensive model. We basically partner with these health facilities. We provide medical and management training, and then we also have ongoing quality assurance and supply chain solutions for equipment and also quality pharmaceuticals. And all this work really leads to improved lives for the patients that attend the health facilities. And these patients are in really hard to reach and underserved areas.
So tell us a little bit about where you're doing this work.
Yeah, right now we're working in 4 countries in Sub-Saharan Africa: Malawi, Burundi, Uganda, and Eastern DRC. But we have a rapid expansion plan in the works. Our goal is by the end of 2023 to be in 10 Sub-Saharan countries. We plan to be working with patients, 10 million patients by the end of 2023. And we're going to have a revenue goal to do that of $10 million. So big plans on the horizon.
Wow, that is big plans. You have an interesting background. You are responsible for development.
I am.
In the last couple of years, you received a promotion to be the managing director of development. I can't remember your title before, manager of development or something, which suggests you're good at your job. But your background, your training, you have a doctorate in physical therapy, and you were a physical therapist for a number of years. That's quite a transition. Tell us about that transition.
It is quite a transition. I went from full-time clinic work to outside the clinic, but all still very much related to healthcare. My passion has always been to serve the underserved, specifically in healthcare. And I had the opportunity to do that as a physical therapist. And then the opportunity to work with LifeNet presented itself. And I really had a heart for the international community and making sure that underserved patients internationally were well cared for as well. And so I jumped ship. I saw the incredible amounts of data that LifeNet had been collecting. I saw that they had proof that they were doing what they said they were doing, and the money they were raising was being spent well. And I thought, I can really get behind that. We could serve a lot of patients, make sure a lot of people have access to high quality healthcare for really a little amount of money. And so I went from, like you're saying, full-time clinical work into fundraising. Wow,
that is a big change. And fundraising, it really can be hard. I have watched people in this space, and people that do it well, people like you who get promotions, have really developed some special skills. And so I commend you for that. commend you for that. You've raised some money on CaringCrowd. Tell us a little bit about your experience on CaringCrowd.
We have, yeah. CaringCrowd has been a great experience. The Johnson & Johnson community, the CaringCrowd team has been so incredibly supportive. They've got this great platform. They're always around for any questions and support issues that we have. They're, like I said, a great encouragement to the fundraising process. And so the platform has been very easy to use. We have done 3 different projects now on CaringCrowd. And essentially, we present different opportunities to people who might want to give, basically join in a crowdfunding effort to make sure that those opportunities come to fruition. So our recent project with CaringCrowd was actually to provide equipment for some of our facilities in Burundi. We had a massive financial goal. It's not often recommended to do such a large amount of money via crowdfunding, but we had the support of Johnson & Johnson, that CaringCrowd team, and we went for it. So we raised over $16,000. That was our goal, was $16,000 in order to procure equipment that's actually currently being procured, and we'll have a container shipped over to Burundi here soon. It was a big partnership effort. We had Johnson & Johnson and CaringCrowd helping us with the fundraising aspect, and we've got 2 other groups, one a nonprofit and one a foundation, sort of matching those funds and getting the equipment where it needs to be. So it was a very exciting event, and it couldn't have happened without that CaringCrowd team.
Now, J&J matches some donations on CaringCrowd. How did that go for you? Did you get some J&J match money?
We did, yes. We really love to capitalize on that. They do run different opportunities where they'll match dollar for dollar up to $250 donations. And so actually about half of that $16,000 was provided by Johnson & Johnson, which was really amazing.
That is amazing. It's just a super powerful way to get that match money going.
And motivating for others too. They know that money will be matched. It's like
right. Yeah. So it helps your crowdfunding in a couple of ways, doesn't it?
It does.
So Maggie, tell us a little bit more about the equipment you bought with the money you crowdfunded on CaringCrowd.
Yeah, well, these are simple tools that we'll provide to our partner health facilities, and they'll use them to improve patient care. One example is maternity beds. A lot of babies are delivered in these health facilities, and they don't necessarily have the equipment that they should have for a safe and healthy delivery. And so part of this container is going to be full of maternity beds so that moms can have a dignified, safe, healthy space to give birth.
Outstanding. The infant mortality rates in that part of the world are somewhat below the U.S. standard, which isn't the highest in the world, sadly, right? Are you measuring some improvements in that as you deploy your work in that part of the world?
Yeah, everything we do is really towards helping people live those healthy and whole lives. And you're right, infant mortality rates, morbidity rates, maternal mortality rates, morbidity rates, they're high. And a lot of our work is towards that, trying to lower those rates. I can give you one example. All over the world, 10% of babies are born needing help breathing. And so one of the biggest things that we do is provide training around infant CPR. So in a lot of the areas that we work, the sort of knowledge of the day is to actually try to hold the baby upside down to help a baby not breathing to breathe again, which isn't usually very effective. And so we provide this infant CPR training, and immediately the nurses who are taking care of these babies can implement what they've learned. One example actually just happened recently. One of our trainers just shared that he had taught the infant CPR lesson just a couple months ago, and he went back the following month for more training, and the nurses ran up to him saying, "We're so excited, this is working." And one had said that she had even used it twice already and saved the lives of 2 babies already. So
Wow.
really simple techniques that are international standard and protocol that is considered to be best practice, just implemented in a hard to reach place, can save a lot of lives.
It is amazing sometimes how far a little money goes in Africa to save lives. I mean, powerful story. Thank you. Well, as you look back on what you've been doing with LifeNet. What are you most proud of having accomplished?
That's a great question. I think stories like that are what we're most proud of. Simple techniques implemented in these hard to reach places are saving and improving lives. And that's sort of our overarching goal and what we're accomplishing. And so I would say that's really what I think I'm most proud of LifeNet for doing. The other thing that I think is a point of pride for the organization is that we're really asset-based in what we do. And that means we're not coming in as this international NGO with this great idea, but we're really sort of starting from the ground up. We did 3 years of iterating and prototyping for our model, lots of local input. The majority of our employees are local. So it's really more of a local solution. And what we're doing is looking at the assets on the ground and saying, hey, there's all these great health facilities. There's all these health workers and managers who want to do a great job. They're caring for tons and tons of patients. What are the little tweaks that we can do with what's already on the ground? The knowledge, the skills, the expertise, the resources. What can we do just to capitalize on those things, to bring them all together, make them function a bit better? And so that way we can all kind of work together to make sure that the communities have the care that they need.
Well, that is powerful stuff that you're doing. As you work at this and you reflect on your clinical experience and all the rest, what's the most important lesson you've learned about doing good?
Good question. I'd say listening. Listening's key. I think it's very tempting personally and perhaps as a community, maybe a Western mindset, it's easy to come in with a solution, but I think the best way to do good, as you're saying, is to listen first and really listen to both the needs and the resources that are already available.
As you were working in the clinic, you talked about this a little more, but I want to dig deeper about this transition you made from clinician to fundraiser. In the clinic, you had the opportunity, and of course in your job, literally to put your hands on someone and help them learn or relearn skills. You have a specialty in neuroscience, so I presume you were working a lot with TBI and stroke kinds of victims and that sort of thing, or survivors. That seems like that would be really rewarding. I mean, just to really be able to take a patient from the really post-accident, post-trauma, brain problem, stroke or something, and then working them through back to a healthy position, so incredibly rewarding. Raising money can feel so distant from the benefit, so distant from the good. How did you make that transition? Why did you want to make that transition? And what makes you good at that?
Well, you're right. It is incredibly rewarding to be in the clinic and to see those results. I'm really fortunate that LifeNet actually does have clear results that I can see as well. That's one of the only reasons I jumped ship from the clinic to work with a nonprofit doing fundraising, is because they had clear results, clear outcomes, clear improvements in patient lives. That's really, a lot of what motivates my work in healthcare, as you're saying. I would say also an important part about the joy of fundraising is not just the program side of things. Of course, I'm completely in awe when a life is saved by infant CPR, and that's a huge motivation for why I do what I do. But the other side of things is the relationships that are developed for those who are passionate about the same type of cause. So every single person who is given $1 to $100,000 at LifeNet is motivated as well to care well for the underserved and to make sure that people can live healthy and whole lives. And so it's really quite a fun job to connect with other people who are passionate in the same ways and to be able to look towards one mission together as well.
Fantastic. That's brilliant. As you reflect on what makes you effective in your job, what is your superpower?
I don't know about my personal superpower, but I will say that I think LifeNet's superpower is, togetherness and caring well for each other. We call the LifeNet team the LifeNet family. And we really our whole LifeNet way is built around a cultural concept out of Burundi. And in Burundi, if a person, a friend, a family member, just an acquaintance is at your home and they get up to leave, you end up getting up with them and walking with them until you know that they'll arrive at their next destination safely. And that spirit is really the spirit of LifeNet. That's the LifeNet way, that we're together as friends, using the resources that we have, caring for others. And I think that's really the superpower behind us.
Oh, fantastic. Well, Maggie, thank you so much for taking the time to be with us today. We're so grateful. Before you go, though, would you take just a minute and tell everyone how they can learn more about LifeNet and how they can connect with you personally?
Absolutely. Our website is lninternational.org. We're on Facebook and LinkedIn as well. And you can reach out to us via email if you'd like at contact@lninternational.org.
Fantastic. Well, again, Maggie, thank you so much for being with us today. We wish you every success in the great work you're doing to save lives in Sub-Saharan Africa.
Thank you, Devin. I appreciate your time today.
All righty. Let's do some good.
At CaringCrowd, we believe everyone has the power to make a difference. Through our crowdfunding platform for community health, we empower passionate people to drive real change. Whether you work for a nonprofit organization, volunteer, or want to get involved for the first time, you can post a campaign on CaringCrowd. Join us, because caring is where change begins.
Thanks for tuning in to the Your Mark on the World show, the Social Impact Podcast. Please subscribe via YouTube, iTunes, Google Play, Stitcher, or Spotify.